my name is Hope. I'm from SBK Healthcare and I am delighted to welcome you to the recording of this cancer service webinar on providing personalised care and support planning with the wonderful Leah Morgan. I do hope that you enjoy the webinar and find it useful. Please make sure that you subscribe to our channel so you don't miss any new content that we upload, and do also make sure that you like and comment on this video. Thank you very much.
Thanks very much. I will just do the technical thing of trying to share my screen. 2 seconds. So yeah, thank you very, very much for having me, and thank you for joining today as I speak about personalised care, the importance of it, and basically why bother with it. My name is Leah Morgan. I'm the Personalised Care Lead and Cancer Improvement Facilitator over at Shrewsbury and Telford Hospital NHS Trust. All of my details are there. I'm afraid with the number of different elements that personalised care actually involves, this is going to be a bit of a whistle-stop presentation about the different elements involved. So I apologise if I speed up as I look at the clock going closer to that 45 minutes, but please do feel free to get in touch with me following the presentation if you want to know anything in more detail about how I embedded the different kind of projects here at SATH, or if you've just got any kind of general questions, please do reach out and speak to me at any point. As Hope said before, all of the slides today will be sent out, but with the additional information that I speak about. So just a little bit of background really nationally. So Macmillan estimate that there's currently 3 million people living in the UK living with cancer, and that's set to rise by 2030 to 4 million and 5.3 by 2040. They identified stages along people's cancer journey when experiences are commonly shared, with 5 key moments being diagnosis, treatment, recovery, which includes living well after cancer, and living with the consequences of cancer, living with treatable but not curable cancer, and end of life. There is a particular high level of unmet need. Macmillan estimate around 1 in 4 people with cancer are living with the long-term consequences of cancer and its treatment. It was highlighted back in 2015 as part of the Achieving World-Class Cancer Outcomes, a strategy for England, and it is number 4 on the list of the 6 strategic priorities there. The report highlighted the need for people to have that support throughout treatment to empower them for when that treatment ends, and it highlights the importance of supporting the person as a whole, identifying what matters to them from an early stage. So cancer obviously can affect all areas of people's lives, including relationships, works and finance. And a study held showed that 83% of people say that they are financially impacted by cancer. So the NHS long-term plan was published back in January 2019. At the time, cancer survival was at the highest it had ever been, and 1,000 more people were surviving for longer. For patients diagnosed in 2018, for example, 1-year survival was nearly at 74%, which is a 10% increase from that in 2003. The NHS long-term plan states that people will get more control over their own health and more personalised care when they need it. The NHS have developed a comprehensive model of care, and it says that people will access personalised care through 6 approaches, which are patient choice, shared decision-making, supported self-management and self-care, social prescribing and community-based support, personalised care and support planning, and personal health budgets and integrated personal budgets. So nationally, Cancer Alliances are working to ensure that every person receives personalised care and support from cancer diagnosis onwards. There are 3 key areas of work, which are personalised care and support interventions, personalised stratified follow-up care, and quality of life. So the quality of life measurement was launched back in December 2020 following a 3-month pilot in September 2020, and initially it concentrated on 3 diagnoses: breast, colorectal and prostate. However, after that they did that 18-month pilot. Following then, it's now extended to all of the cancer types from October 2021. It incorporates two questions from two standardised measures of health-related quality of life and assesses areas such as mobility, self-care, usual activities, pain and mental health. Now, the idea of this quality of life survey is about understanding the impact of cancer and how well people are living after their diagnosis. So it includes this wide range of concerns, such as people's emotional well-being, finances, ongoing physical problems. And the information collected from the survey will hopefully help us work out how to best support those people living with and beyond cancer. Patients completing the survey can access their own individual assessment and summary report, which shows their overall quality of life scores with a comparison to the general population. And the first national report has been released as part of the NHS England and NHS Improvement and NHS Digital, and that was released back in October 2021. In the slides that I send out, I'll put in links to different resources that you can access, including the report for the quality of life, just if you want to have a little look. So locally, the Shropshire, Telford and Wrekin Integrated Care System have been working together to develop a local 5-year cancer strategy. And as you can see, number 7 there on the strategy is around living with and beyond cancer. A study by Macmillan revealed that 1 in 3 people living with and beyond cancer experience moderate to severe unmet needs at the end of treatment. In addition, the National Patient Reported Outcome Measures have found that people with cancer experience persistent long-term problems. Furthermore, there's a significant body of research and evidence supporting the efficacy and benefits of promoting a self-care and self-supported management approach to support recovery and survivorship. So as part of our local cancer strategy, we will be looking to continue to embed the personalised care elements for all people with cancer, the personalised stratified follow-up, which I'll talk briefly about later on, and look to keep rolling those out within different teams going forward. As well as that, we're looking to improve the use of digital technologies to support the people living with cancer. What is personalised care? So really it's that one size does not fit all approach to the health and care. The one size fits all health and care system simply can't meet the increasing complexity of people's needs and expectations. It means that people have choice, they have control over the way that their care is planned and delivered, empowering people to have choices, taking into account individual needs, preferences and circumstances. And it really, really focuses on the what matters to me element of their care, being seen as a whole person, valuing their skills, their strengths, their experience, and more important relationships around them. Being able to access information and advice that is clear, timely, and it meets the needs and preferences of that person, and being valued as an actual active person and in conversations, decisions about their health and care and well-being, and linking them into the people that would be best to be able to support them, whether that be within the trust that they're being treated or out in the community. It provides a positive shift in power and decision making that enables people to have that choice, that voice, that ability to be heard and be connected to each other as well as those in the communities. And it enables people to build on their strengths and promote their independence from time of diagnosis throughout treatment and beyond, whatever that beyond may look like. Having access to a range of resources to help build knowledge, skills, confidence, in being able to manage their own health and well-being at a time that is right for them. And it supports the person in a behavioural or lifestyle change to help manage treatment, the side effects, and their future healthy, hopefully healthy living lifestyle as well. Personalised care, these are only just 5 main elements of personalised care, but there are lots of different other ways that we can support people around personalised care. But the main elements that we will briefly discuss today are the personalised care and support planning, which are based on the holistic or health needs assessments, the Living Well offer, the treatment summary, cancer care review within primary care, and the personalised stratified follow-up. So to talk about the health or the holistic needs assessment, I think that it's known as the holistic needs assessment, but we did a local survey around the word holistic, and it was very much spoken about locally that people didn't really understand what that word meant, and so locally we use the word health, so health needs assessment and personalised care and support plan. It's a collaborative piece of work within each of the teams, and each of the individual teams work differently so that they are able to meet these needs of their group of patients, their speciality of patients, in a timely manner that is right for them. Being able to outline the aim of the project and why embedding this would be beneficial to patients, staff and the service was crucial at the start to support that delivery and the need from a personalised care perspective as well. It helps identify the needs or concerns of that person at different points in the pathway. These can change, so offering that opportunity to talk is really crucial at different stages. Data shows that most concerns that are actually spoken about are of a non-clinical nature. One thing that we have highlighted is sending out this checklist. Well, we did have quite a lot of feedback to say, oh, well, it's just another tick box. The idea behind the checklist is that it just gives them an idea of maybe some things that they would want to talk about, but really the meaningful conversation that person who is having with the patient on the end of the phone, that's actually where you're going to find out what those person's concerns are. So that communication and those communication skills, having that meaningful conversation with that person, that's where you find out what's going on with them, what matters to them mostly. And what we do to support that meaningful conversation is we do offer full communication skills from a trust level, as well as full education and training on how to input that data after you've had that conversation with that person. We use Somerset Cancer Register here at Shrewsbury and Telford Hospital, and we use that template to complete our H&As and care plans. And it's really essential that H&A is completed correctly, so that the personalised care and support plan following the H&A is completed if appropriate. But it's also needed so that the data recorded is true, so that we're able to pull what the needs are of our people who live locally to us, and the people who are being treated at SAF. What is it that people are looking for? Is there a gap that maybe we could do something about? So is there something that we need to address locally as well? But also, in addition to that data is then sent to the Cancer Outcomes and Services data set, which is used by the Cancer Alliance to provide information on how many H&As are being offered, how many H&As are being declined, and the reasons behind those H&As being declined. We develop locally a passport to living well, which is given at time of diagnosis within the patient information pack. It gives key information about services available, as well as local and national support services and charities. The aim of the document originally was to use as a tool to help have that discussion, talking with the doctors, the nurses, and other healthcare professionals, enabling the patient to have a bit of control and use the back pages where the notes are, to make notes and actions and keep a record of their own care, just giving that ability to empower that patient early on from time of diagnosis throughout treatment. And the idea was to enable them to be more involved in their care. So the personalised care and support plan that follows, if appropriate, with the H&A is that clear outline of the conversation and any actions identified. So on the right-hand side, you can see where the concerns have been pulled through from the H&A completed on Somerset. They're the concerns that were identified throughout that conversation with the professional, about what matters to them, and an opportunity to learn about other services that can support them to manage their concerns, which is then written in the details, the patient actions, and where the support worker has been able to support them. The idea of the personalised care and support plan is that it's person-centred, that they're central in developing and agreeing their own support plan. So if they do take any actions on themselves, as well as having the number to ring back if they're having any issues, to give them that confidence to say, okay, well, why don't you contact them? If you have any issues, you can ring me back, and really trying to give that empowerment to the patient from early on. it really is around that conversation around what matters to them, to have that proactive, personalised conversation which focuses on their needs and wider health, well-being, really agreeing those outcomes of that conversation and just writing it in a summarised way so that it's clear of the objectives, what they spoke about and what actions are to be taken forward. But to be understand that this can be reviewed at any point. As I've just said before, things do change throughout after following that diagnosis, throughout that treatment. So it's being able to go back and say, actually, now I've got these concerns, can we talk about what's available for me? And it's owned by that individual. So sending that care plan and summary of that conversation out to that patient to say, this is what we spoke about, this is what I have said that I will do for you, and this is what you've said that you will do to help yourself. And with that patient's consent, we've also linked in with our local GP practices throughout Shropshire, Telford and Wrekin. So with the patient's consent, we now send an electronic PDF for that to go onto their electronic files within their GP practices. An absolutely vital part of being able to manage this increased workload is our cancer care navigators and support workers. We now have 10 substantive navigators within our trust and 7 fixed term. Overall, helping patients, the clinical team, and looking for improvements and streamlining of processes, supporting the increasing demand. They're really patient focused, providing that personalised care, their first point of contact, improved ease of contact, so the less chance of having to leave an answer phone message. And if there is a need to leave that answer phone message, knowing that it will be picked up sooner than potentially it was a little while ago before the navigators came into post. Improved patient experience, navigate complex health and social care systems. They can prevent cancellations and wasted appointments because that person is able to pick up the phone and speak to somebody who can then reallocate an appointment for that, but also give somebody else an opportunity to sit in that appointment that they've cancelled. Vital during the COVID-19 pandemic, and we did a small audit to show that actually by the navigators completing the non-clinical elements of this H&A, it actually saved 31 hours. Doing 62 H&As, it saved 31 hours of clinical time for the urology CNS when we did it a little while ago. So it's an ever-growing workforce. In the last 12 months, we've recruited into our oncology departments. But it's such a vital part of personalised care and supporting the CNSs when capacity and work life is just growing and growing. Our living well sessions, or you might read the health and wellbeing events. So when I started about 6 years ago in this post, it was a very different model. I kind of came in and said, okay, we need to figure out what is it that people really want from these living well sessions or health and wellbeing events. The aim is to give information and support at the right time for people, for family, friends, following that cancer diagnosis. And it focuses on helping and supporting you live as an active and full life as you wish and are able. It covers a variety of topics and it can signpost you to other services. So we did a few focus groups with patients, their loved ones, and asked them what they wanted. We also looked at what are the most common topics that are spoken about, and we came up with 4 topics. So our Living Well session covers 4 topics. It covers fatigue, emotional well-being, nutrition and physical activity. They're held monthly in community settings. They're open to anyone affected by cancer. They're free to attend. Information and signposting. So throughout the day, the idea is that we talk about the benefits, challenges or barriers of these things. We then actively talk and encourage people to share their experiences and listening to others. Signposting them to different services that may be able to help, but with a big focus on how you can safely self-manage these things away from the hospital setting. It did come with its challenges. Money is always the first challenge. So financially, when I first started in post, I was the recovery package project manager, funded by Macmillan. And as part of that, we had a little pot of money to do a pilot. So we did an 11-month pilot, and within those 11 months, we had 391 people walk through the door, saying, yes, I want to know about how to help myself. What can I do? What small lifestyle changes? We're not talking about big things. We're not talking about how to get to a marathon necessarily. We're just talking about those small lifestyle changes that people can make to help themselves. So following that pilot, we then put a case together for the trust to take this on going forward. And each year I have to put that case together to say, this is what people are looking for to secure funding for the following year. I've just secured funding for all of 2024. And one of the biggest things that I would say is the evaluation forms and that follow-up data that I gather 3 months following. That has been incredibly paramount in being able to show just how much it is helping someone. And the people that come attend. On average, we get between 25 and 40 people, depending on which area in Shropshire, Telford and Wrekin we go to. The other challenge that we had was capacity for workforce to join the sessions. Understandably, especially with the increased numbers that we're seeing recently, we needed to look at that model and how we could get people to support it, whilst allowing the clinical teams to carry on with the brilliant clinical work that they're doing. So our sessions are non-clinical. It is really about behavioural and lifestyle changes. So we actually then started up within our programme a cohort of volunteers for our programme, who facilitate those conversations on the table. Our volunteers are people with lived experience of cancer, whether that be having lived with a cancer diagnosis or whether supporting someone who's been living with a cancer diagnosis. We find it works really well, and actually they've become so engaged, which is absolutely great, that actually they've started presenting some of it as well. So yeah, it's going okay so far. So here's to 2024, and let's see what that brings. Treatment summaries. So the treatment summaries, the idea behind this is it is a minimal jargon summary of care. Not too long, just a summary of care given to the patient, the GP practice, to outline that diagnosis and staging, including the read codes, treatment received, including the treatment aim, information on whether the patient should be added to the primary care, palliative or supportive care register, the possible short-term treatment toxicities and side effects, including when urgent review is required. And with that, making sure that it is clear who to ring and when. Information about the consequences, the side effects of treatment, any actions that the hospital are going to take, and any actions for the GP to monitor and support that patient in primary care. A summary of information given to the patient about their cancer, their future progress, information about other lifestyle and support services available for patients to access, and like I said, those contact details, which are absolutely vital for the patients on these treatment summaries. It continues to be a work in progress. I'm a few years in now, and it has had its challenges, but understandable challenges with engagement from some teams. Mainly because of their clinical capacity. They're just incredibly important, but it's just that step by step. And obviously we try and concentrate on one team at a time and recognize that their pathways are so different. But slowly but surely we're getting there, one team at a time, and it's really, really great to see it when people do become engaged with these treatment summaries, because the benefits really are spectacular, not only for the GPs, having that treatment aim is excellent. GPs have often felt that it's not necessarily clear on the letters and discharges. So just to have it there, clear and precise, a clear summary of diagnosis and treatment section on the GP actions, that fantastic resource and support when identifying the needs of the patients at the cancer care review, which is done within primary care, but also the benefits to the patients as well. One of the biggest things that I won't read all of these. There's two that really stand out for me personally. The first is that somebody went on holiday within the UK, and she said, I was so lucky to have that treatment summary because unfortunately she had to go to A&E, and she was able to provide that treatment summary which outlined all of the care she had, the kind of things that they needed to look out for, and it was really, really helpful for the clinical staff in that A&E department to have that treatment summary, just that summary of care that person had been through. But the other one, which I love, is that I could take control of my own care following treatment. The whole point of personalised care, the whole point of why I'm in the job that I'm in, is really about empowering that person. From my clinical background, one of the things that I used to do was do follow-up calls with patients, and one of the biggest things I found was actually it wasn't the actual episode of care that they were actually wanting to talk about. It was actually after they got home, and how do I cope now? I don't know what my new norm is. I don't know what support services there are for me. Can you help me? And the amount of times I heard that is why I'm so passionate about personalised care. Cancer care reviews, so supporting people to live well with and beyond cancer in primary care. So it's about having that conversation between a patient and their GP or practice nurse about their cancer journey. It's an opportunity for patients to talk about their cancer experience, concerns, understand what's going on with them, what's available for them within the community, and receive the information they need to be able to begin that self-supported management. Part of the quality and outcomes framework, it states that patient should receive information about support and local services within 3 months of diagnosis, as well as give that opportunity to discuss anything that might be going on with them at that point. It also just gives that person who's had that cancer diagnosis the knowledge that the GP is aware that they've had that diagnosis as well. However, within the 12 months of that date of diagnosis, they should also have an offer of a cancer care review. Slightly similar to the H&A in the way that it is discussed. You have your clinical elements. Is there anything clinical to discuss here? But the majority, similar to the H&A, of things that are spoken about is usually handled by non-clinical staff within the GP practice. Again, the non-clinical workforce is growing very slowly, but growing out in primary care as well. And they're so vital to be able to support those people in the community, know what's going on for them, know what support services are for them, referring back into other referral routes, such as we've got a Macmillan Welfare Rights team, which is incredible. Our Macmillan centres, the staff there are incredible. We've got cancer rehabilitation programmes. Well, all of those services that are available for them need to be known, and that's where those non-clinical roles, both in secondary and primary care, are just so incredibly important. Personalised stratified follow-up, also known as open access pathway, self-supported management pathway, patient-initiated follow-up pathway. There's a number of terms for them, but for today I'm going to call it the personalised stratified follow-up. That is part of the NHS long-term plan for cancer. It states that after treatment, the person will move to a follow-up pathway that suits their needs and ensures that they can get rapid access to clinical support when they're worried that their cancer may have returned. It is a vital part of delivering world-class cancer services while addressing the serious challenges of demand and capacity throughout cancer pathways, but it needs to be done well. And when I say that conversation, when somebody is going on to a personalised stratified follow-up, is absolutely crucial. From speaking to some patients at Live and Well sessions when we've been holding them, Some feedback that's always remained in my head was that they thought that they'd been discharged from the hospital. So making sure that we are really having that conversation to say, you are not being discharged from the hospital. You can ring us at any time. Your treatment summary is here. If you get any of these, you ring us back, knowing that they are still going to get their scans, still going to get their bloods, tests, investigations. That conversation when people go on to this pathway is absolutely crucial. And as part of that stratified follow-up pathway, they should be offered that information about signs and symptoms to look out for, which could suggest that their cancer has recurred or progressed, which is part of the treatment summary. That rapid access back into the team, including through telephone advice or support, or if they've got any concerns about symptoms, including those which could be due to side effects of treatment. The regular scans, tests with quicker access to results to reduce anxiety, and that personalised care and support planning to enable them to self-manage as appropriate to improve their health and well-being now going forward. So it can, this is a brief overview. So from MDT, it'll have a clinical review. From there, it will be decided as to where they go onto these pathways. And one of the biggest important things to note here is that it also is patient choice. If they don't want to go on to that stratified follow-up, they have every right to turn around and say, no, thank you. I would like to be, I'd like personalised led follow-up. That's absolutely fine. It's from speaking to my breast care navigators, who are well established with this pathway now. They have over 2,000 people on their remote monitoring system, and only from last time speaking to them, only 8 people have so far asked to go back onto that personalised led follow-up. But that is with having the right conversation with those patients. So that patient-initiated follow-up is timely re-access back onto the pathway should it be needed. That remote monitoring, however, if that patient prefers or whether they have more complex needs and it's not appropriate for them to go onto that stratified follow-up, they'll then have the personalised led follow-ups where it might be consultant-led, nurse specialist-led, telephone-led, or primary care-led. It's usually, and then obviously the other 2 pathways below there, supportive and palliative care, and that transition to end of life care, where it's then that care is then normally taken over by our fantastic palliative and end of life care teams within the hospital or out in the community by our supportive hospice colleagues. Benefits for patients. So again, I'm not going to read all of these to you, but as you can see, there's quite a lot. Improve patient satisfaction, and this is from doing a survey, and a reduction in anxiety, knowing that if they need to come back, if they need to call at any time, they can do. That improves that patient engagement with their health. It empowers patients by allowing them to book appointments when they most need them. And a few more here. One of the biggest was around the cost actually of coming back to the hospital. So here, Shropshire, Telford and Wrekin, it's just massively rural, and we also treat people over in Powys as well. So potentially people can travel up to potentially 2 hours to just get to a hospital appointment to then travel 2 hours back. So if there is a need, obviously we would always ask them to come in to have that conversation with one of the clinical team. However, if everything is absolutely fine with the investigations, it just saves people having taken the time, the cost at the moment of traveling as well. So there's lots of different benefits to the stratified follow-up. Also for professionals as well as systems. So for professionals, it provides a mechanism for the clinician to jointly develop plans and the what-if scenarios with patients and share clinical risks. But also for systems, a reduction in did not attends and improved use of clinical resources, a reduction in unmet need and clinical risk from patients being on waiting lists for follow-up appointments. And it really does support that greater integration of care as well. But to be able to do that, we need to look at this whole system approach. So 25 to 60% of cancer survivors have unmet social needs, which impacts on their health and well-being. As an increasing number of people are living with or beyond cancer, unmet social need will only become a problem for more people. 70% of people actually living with cancer will also have another long-term condition, and this strengthens the need for support, both within the primary and community setting, as well as empowering people through personalised care. From our kind of point of view over at SATH, we have built really fantastic connections with our colleagues in primary care, with our colleagues and organisations, services, fantastic work that's going on in the third sector, the voluntary sector, of charities that are supporting people. And so building up that network of organisations and services so that we're able to help our navigators know about them so they can then share them with their patients. It's been really, really empowering for me as a personalised care lead. And we've also grown really good connections with our social prescribing teams throughout Shropshire, Telford and Wrekin. Originally, we were having to refer people to the GP, who would then refer into the social prescribing teams. And what we've done is we've streamlined that process so that we're now able to just directly refer into the social prescribing teams should there be a need. And we've done so many referrals into that social prescribing team, who then contact the patient or are able to support. Now, although they're not cancer specific, as we have been able to identify, it's not always necessarily the cancer that is the issue. It's sometimes or everything else that's going on in their life. And so if we can kind of reduce those worries and anxieties, hopefully we'll be able to provide a healthier lifestyle, a healthier reduction in anxiety, a reduction in worry for that patient, so they're able to concentrate on what they're going through following that cancer diagnosis as well. Our Living With and Beyond Cancer app, so the Cancer Support Information and Wellbeing app, was launched back in July 2022. So the foundations of the app were developed by Piota Healthcare. The content has been delivered and developed by myself and the cancer services team at Shrewsbury and Telford Hospital. But we work with everybody, and we are open to any kind of suggestions of content changes. And I've been told, oh no, that service isn't there anymore. And it's really a group effort from those living and out in the community and experiencing those services. It's a non-clinical information app available to download for free. It's divided into 12 sections, as you can see there, to attempt to make it more user-friendly. With smartphone ownership at 95% in the UK, the app provides that 24/7 platform of information for people affected by cancer to access. It enables people affected by cancer to access information about services and organisations that may benefit them, provides that information about treatments, teams that they may come across in their pathway. And then obviously, as part of the personalised care agenda, it's about empowering those people with the information. I've said there about promotion of the app. Literally anybody who'll listen to me talk about the app has heard about me talk about the app. And I'm more than happy to talk about the bits and bobs in between. If you want to know more, please do get in touch with me. But we've been on radio, we've been across to primary care, we've been across to all of the community settings. We talk about it within our hospital. We've been in the local hospital chatterbox, which is our local newsletter. We've been in the Shropshire Star, which is our local paper. It's pretty much anywhere that will listen to me talk about the app have done. And as well as that, we're really proud to say that the app was shortlisted for the Nursing Times Awards this year, as well as the Patient Experience National Awards as well. So we're really proud of it. And by all means, if you want to know any more, please let me know. So how is it going at the moment? So the number of downloads, like I say, it was July 2022. So the number of downloads at the moment is 831, and the user interactions is over 116,000 now. As you can see, there's lots of different quotes there. But one of the things that I do like is not just people from within Shropshire, Telford and Wrekin are using it. This patient's son who lived in London downloaded the app to know more about the hospital that his father was being treated in. It just meant that he could understand a little bit more about the team. It was just really interactive and really beneficial for him, living so far away as well. We're always open, like I say, to suggestions of content, and we do say that to people. If you want to have a little nosy, again, these slides will be sent out to you at the end, but please do feel free to download it, have a little look. We would encourage our patients to download this at time of diagnosis. So even if they wake up at 2 o'clock in the morning, they've got somewhere to go. Now, it might be that, to be honest with you, what we've heard is the most difficult thing is actually downloading it. And that's usually from people who are not necessarily smartphone or tech savvy. But actually, once it's downloaded, it's really easy to navigate. So we would encourage anybody who, when they say, oh, no, I can't do that, is to actually help them to download it, because once it's downloaded, they go, oh, yeah, it is easy to use, isn't it? So once you've downloaded it, you'll see the man, the white man in the green background. But actually, when you open the app, you do need to search for South Cancer Services, and then you'll see our front screen with the butterfly there. Whistle stop tour. But thank you so much for listening. Please do contact me if you have any questions following this webinar. I'm here to help where I can. Thank you very much.
Thank you, Leah. That was brilliant. We have got some questions, so I'll just get straight into them so we can answer as many as possible. So the first one is from Helen, and she's asked, please, can you demonstrate what the PCSP looks like? Thank you.
I can, but probably not on here. If you want to email me, just because obviously I'd have to go into our test site, but I can actually, the palliative care and support plan, I can actually talk how we actually go through and what processes we use. I can actually show you on our Somerset test site. So if you want to get in contact with me after this webinar, by all means, I'll go through all of that. I can show you examples of the personalised care and support plan that we have developed, by all means.
Oh, brilliant. So the next question is, what is the difference between a navigator and a support worker?
A really good question. Pretty much nothing, in the sense of in regards to the role. It's like anything, unfortunately, because there wasn't a set name for that role. The reason that I've put navigator and support worker is because nationally they have different names for the same role, but overall the essence of whether you're a support worker or a navigator is really the importance of that role is they do the same to support that patient throughout their journey or pathway, to provide that personalized care element. The actual role itself is the same, it's just a different name. And the reason that I put that is because I have colleagues who have support workers. We call them navigators. That's all it is. That's the only difference.
Brilliant, thank you. Someone's asked how often the events are.
So so that was one of the biggest challenges, is we don't have actually any guidance in regards to how these health and wellbeing events should be held. So we have developed them so that we hold them monthly. We go out into community settings on a monthly basis. We hold them in Shrewsbury, Telford, Oswestry, Church Stretton, and last year we held them in additional places, Bridgnorth, Ludlow. But there is no guidance. So unfortunately, it's what you can do and whatever you feel is going to be beneficial. The actual Living Well sessions that we hold are different to what my colleagues in other areas hold as well. So they do more of a bigger event every quarter. So they hold more market stalls, so that it's kind of come to see the market stalls. They get clinical people there if they want to ask questions. It's really whatever model you decide within your area. The reason we went for ours was purely from feedback, from questionnaires, from surveys. What do you want? That's the reason that we went for that way.
Okay, brilliant. Thank you. So the next question is, was your app funded by the trust or externally? I have suggested something similar in our trust, but funding is an issue.
Yeah, so way back when the first discussions happened around the funding for our app, we had already established our health and wellbeing events or our Live and Well sessions. So initially, as part of the health and wellbeing money from the Cancer Alliance at that time, we utilised that money in a different way to provide that health and wellbeing information on our app. So initially, it was the money was funded from the Alliance. I know that regionally here, I know that there is talk around another app being developed and implemented within the region, which will be for each of the trusts. We've obviously got ours up and running now, but when our contract ends, it will be about putting a business case together to secure funding, as it always is.
Brilliant. Next question is, what's your opinion of the use of distress scores during HNAs? Do you find it useful?
Yeah, thank you for this question. So this is a question that we have navigating meetings at our trust, which I chair, and it's one of those questions that we have spoken about in the past around those distress thermometers. So for me, and this is personal opinion, for me, having a meaningful conversation, you will understand how much of a concern that is for that patient. For me, it makes it less personal, going, oh, on 0 to 10, how does that make you feel? You can gain that understanding from having that meaningful conversation, from using those communication skills that you have, and you have that ability to have that conversation with that person, to identify, okay, so they just want a little bit of information, so I'm going to send out a little bit of a booklet to you. Is that okay? Versus this is having a detrimental effect on me. I can't sleep. I can't eat. The worry is eating me alive. You can obviously sense that that is really, really worrying for that person. So distress thermometers, they have their uses in the sense of yes, for more, but more in my opinion for people who are looking at that summary later on. So if you were to put a distress level at 9, they'll go, oh, that was really, really difficult for that person, maybe I should talk about it, rather than can you give me a 0 to 10 on how you're feeling about that personally.
Brilliant, thank you. Jade has asked, is the app just for your area?
It is, yeah, but what we will say is that yes, we have local services, local charities, local things on there, but actually we have a lot of national things on there as well. So we have a list of national charities that anybody can access. I'm working with a CNS in oncology to develop our Lingen Davis tile, which will cover side effects, a little bit more information about how people can safely self-manage things like fatigue, sickness, that kind of thing. So that's in development at the moment. So although it is local, actually there's a lot of information that anybody could benefit from. And I have said this when I've been speaking to other people, I've like, just download it. And then worst case scenario, that you can't find anything that you necessarily want, so you uninstall it as well, and that is their choice, and that's they're empowering them to have that information.
Brilliant. So what are your views on uploading the care plan to your trust EPR and not just Somerset, which can be a hidden system? We have resistance from our CNS workforce.
I guess you mean you have resistance in uploading it to the EPR. I haven't really had that resistance that I know of. And the reason, I think for me, that is through explaining to the different teams that actually by clicking that button and it going on to over to the other system, it just, all that is doing is enabling that information to be shared amongst colleagues. We are very similar. Our oncology department don't use Somerset because they have their own software system and they document everything on our clinical web portal. Well, by linking the two, all we're doing is strengthening that information, and it's a way of communicating, isn't it, between our teams. And when patients can potentially go from surgical to medical to oncology teams, just by providing that click of a button to share that information, actually it's going to be so beneficial for that patient without having to go through everything over and over again. They're already potentially overwhelmed with what they're going through. So if we can work together as teams to provide that information across our teams to potentially really help that patient, for me, why would we not do that?
Okay, brilliant. So the next question is, what data do you collect to evidence the benefit of your Living Well event?
Thank you. So at the end of our Living Well sessions, we do an evaluation about the day. So how has it been beneficial? What will you take forward? Is there anything that we can, because we always say, look, we like the good, the bad, the ugly. So if there is something that we can do to improve the day, please do let us know. So that's more about the day. So then we will follow up with those that are happy for us to do. We will do a follow-up call, usually around 3 months, in the 3-month mark, to ask them questions to say, following on from your Living Well sessions, did you access any support services following that Living Well session? Did you do a H&A with your navigator? Did you make any lifestyle changes? Did you start a journal to help with your emotional well-being? Did you change anything to help with fatigue? Did you start taking more naps? We've got like loads of questions, but again, most of those questions actually come from not from set questions necessarily, but just from having that meaningful conversation. So ringing up and saying, how are you doing? What did you do to help yourself? And is there anything else that I can actually signpost you to?
Right, brilliant. So can you please share any of your experience and thoughts related to boundaries of a CSW role, if any at all, please?
Say that again to me, sorry, Hope.
Could you please share any of your experience or thoughts related to the boundaries of a CSW role, if any at all, please?
Yeah, so the cancer support worker role, obviously within our, and I can then talk from a local point of view, us locally, it's really important that it is recognised to be, they're there for the personalised care element. We have had its challenges in regards to the navigators potentially being used for more admin roles, and that has been an issue. And potentially in some teams it still is, but it's something that we're definitely highlighting and addressing, and having those conversations with the teams as to, okay, well, what can we do? The idea behind the cancer support worker was and always has been around supporting that person being main point of contact, but from a non-clinical perspective, and for point of diagnosis onwards, unless otherwise stated in the contract. But for the majority, it's from that time of diagnosis to be that point of contact around personalised care. There's always going to be challenges. There's always going to be, in anything that you do, but it's about just hopefully being able to have a conversation and talk about what is best. I mean, I truly believe that everybody who comes into this, the health and healthcare environment we're all here to do the best that we can for our patients and their loved ones.
Brilliant. So we've got about 5 minutes left, so we'll try and get through some of the rest of the questions. How do you keep your Living Well passport up to date with the constant changes in local services?
Yeah, thank you. So our passport, and by all means, whoever that was, please do get in contact and I'll send an electronic copy over to you, or anybody who wants one. So the idea of the passport is more generic information. So how to live well, information about services that are already in post, like our Macmillan information support centres. When we have, if we're talking about physical activity, for example, we don't necessarily put the information about we've got we're really lucky in Shropshire, Telford and Wrekin that we have a fantastic cancer rehabilitation programme funded by Lincoln Davis called the ICAN programme, which is all around cancer rehabilitation. And part of that is around physical activity. One of the big things about how that can help you mentally and physically. And so instead of putting the ICANN details, because as you know, you don't know, unfortunately, you never know what the future holds, we actually write in physical activity. What's the importance of it? If you want to know about services that is local to you, please either download the app or get in contact with us as a team, Personalised Care team, or the local Macmillan team, who will be able to link you in with those services, rather than actually put in the details of services. There are numbers at the back, but they're more kind of our Macmillan centres, our national support as well, things like the Macmillan support line, the Samaritans helpline, and things like that. So we've kind of kept it generic, but so that it can stay in data for as long as possible.
That makes sense. So is there a diverse group of patients attending the Living Well sessions, and how do you reach those harder to reach groups?
Yeah, it's a piece of work that we are working with our brilliant colleague in the ICB about, around health inequalities and reaching out to those hard to reach groups. The simple answer is no, we don't. We do get demographics when booking people onto the sessions, and it is largely white British, usually between 50 and 70, that come along to Living Well sessions. From speaking with the younger, it's mainly because they want digital. They want everything on the digital. Not everybody, but the majority. And in regards to kind of the more hard to reach groups, we're actually working with our cancer champions, who are work really closely with getting cancer champions in hard to reach communities. They are more with a focus of prevention and screening awareness. However, we're starting to work with them to maybe look to see if we can start working with those groups around the pathway from time of diagnosis onwards. It's something that we know that we need to is there something else that we can be doing to support those patients? Definitely.
Okay, brilliant. And I think we've probably got time for one more question. So there's a question around, do you have ring-fence slots for patients who come back in? Our clinics are so booked up, it's difficult to get people booked in quickly.
Yeah, it's really difficult. And that, I think that's why the role of the navigator is so incredibly important. In regards to capacity, it's something that is spoken about a lot on a daily basis. Capacity is just everywhere is fully booked. However, the role of the navigator is absolutely crucial in this. So first of all, being a point of contact for that patient to feel that they can get through to somebody to actually say, I'm really worried about this. And that navigator really working closely with our CNS team so that they can at least do that initial phone call to say, I hear you, I know that, and I recognise that you've got something going on. Bear with me while I attempt to get you a slot. But also having that telephone consultation to say I can hear that you've got something going on, and sometimes just giving that reassurance at the start. But absolutely, I don't think Shrewsbury and Telford are any different from any other trust, with unfortunately the huge amount of demand for clinic appointment slots. Definitely.
Brilliant. That is all we've got time for today. I can see that we've got a few questions still left in the Q&A box, and potentially some in the chat that we've missed. But you mentioned that you're happy for people to get in contact with you if they want to have a chat.
Absolutely, yeah. Please do just get in contact with me. I've all of my details will be on the slides, so please do feel free to ask me any questions.
Brilliant. Thank you so much for taking the time out of your day and sharing the work that you're doing and answering the questions as well. It's been brilliant. I hope you've enjoyed it, and I hope that everyone attending has enjoyed it and found it useful as well.